Hi, everyone. I'm Angela Irvin here with Paula Harvey from the Cy-Fair Houston Chamber of Commerce. And we're here with Mario Garner, president of CHI St. Luke's, the Vintage Hospital. How are you today, Mario?
Well, Angela, how are you?
I am doing wonderful. Thank you so much for asking.
Thank you for inviting me. I'm very happy to be here with the Cy-Fair Chamber.
Well, we are so honored to have you. Thank you so much for being here. So tell us a little bit about the hospital, how long you've been there, and then tell us about the challenges you might be facing right now.
Sure. Well, again, I'd like to thank the Chamber for this opportunity. Very happy to be here with you today. As was mentioned, my name is Mario Garner. I'm the president here at St. Luke's Health, the Vintage Hospital. I've been here approaching 2 years now. Vintage, we are very proud of this hospital serving this community. We have a 10-year history. Our doors opened here in Northwest Houston on December 10th, 2020. So we are approaching our 10-year anniversary, which we'll be celebrating here at the hospital in December. We have an award-winning campus. We've been noted by several publications for the beauty and aesthetics of the campus. And some of the things that we're most proud of is that we're easy access. We're not a large hospital, 106 beds, but very easy, accessible, and convenient to use for patients who choose the Vintage Hospital to receive their health care. We're very proud of the quality that we offer. We are a high quality facility. We just completed our triennial Joint Commission survey in February of this year with very high ratings, and so we're very proud of that. We have many physicians in the Cy-Fair community who utilize our high quality services. We are a full service hospital. We have on a 24/7 basis physicians, high quality academic physicians in our hospital that serve the community and the patients that we take care of. We have board certified Baylor faculty at this facility. We have hospitalists, which are internal medicine physicians that are in the hospital on a 24/7 basis to take care of patients. We have Baylor emergency physicians. We also have anesthesiologists that are Baylor associated. All board certified radiologists and pathologists as well. We have a 22-bed emergency department wherein we see on average, 70 to 80 patients a day. But we're very proud of our performance in the ER because we adopt what we have as a pull to full methodology, wherein we pull patients directly from the lobby into the back of our ER to minimize the wait time that patients may have. We have 106 beds here at the facility, including an ICU, an intermediate care unit, a medical surgical unit, and women's services unit. And we also have a level 2 neonatal intensive care unit. This hospital has a comprehensive array of surgical services, including orthopedics, spine surgery, urology, ear, nose, throat surgery, general surgery, and cardiology services. And what we're very proud of is that we have access to all levels of specialty care throughout St. Luke's health system and also Baylor College of Medicine. So we have a direct corridor to our sister campus in the Woodlands and also to Baylor St. Luke's Medical Center downtown for all levels of tertiary and quaternary care that the Texas Medical Center can provide. We're very proud of our family-like environment. Being a small hospital with about 450 employees, we all know each other by name. We all have open door policies here in our administrative suite. And so that's one of the things I enjoy most about the Vintage Hospital is the culture and the family-like environment. We have very positive patient satisfaction ratings. For the past 3 months, we've actually set records in our emergency department and on our inpatient units regarding our patient satisfaction. And one of the things that's most important to me is that all 450 of our colleagues and our physicians, we have over 500 credentialed physicians and about 130 of them are active, many of whom reside in the Cy-Fair community, but that we are all committed to the mission of Catholic Health Initiative, CHI, and that is to make the healing presence of God known in our world by improving the health of the people we serve, especially those who are vulnerable, while we advance social justice for all. So making the healing presence of God known is very important. We are a faith-based institution, and in fact, that is a major draw for many of our colleagues who work here, is that we are faith-based. For many of our physicians and providers, they enjoy our faith-based orientation, as well as for our patients. And so since that is so important to everyone, one of the things that I want to ensure is that if a patient comes through our doors, we want to make sure that every colleague that they interact with, every provider that they interact with, makes the healing presence of God known. That is through courtesy, through compassion, through kindness, being thorough and attentive to the care, and ultimately treating the patient as if they were a family member. Challenges that we have experienced. Obviously, the past 7 to 8 months have been momentous, I think, for the industry, not only here at CHI St. Luke's The Vintage Health, here in Northwest Houston, state of Texas, and nationwide. I think this has been something that will go down in the history books, our ability to manage the COVID-19 pandemic. But we have done it, and we've done it well. The regulatory changes that have been undertaken in the past few months have been unprecedented. How do we operate in this new norm? How do we integrate technology? How do we operate efficiently? How do we set up our physical infrastructure? And then how do we manage within the regulations, that have been placed upon us with COVID-19? I'm very proud to share that epidemics and pandemic preparedness is something that our staff and physicians have trained on for decades. And we adjust our strategy specific to new infections such as COVID-19 that may affect our community. Our facility has a pandemic or a surge capacity policy, and we are continuously reviewing this policy with our emergency preparedness coordinator and our infection prevention staff to make sure we can adjust based on the specific nuances of our facility. In anticipation of the past surge and potential surges in the future, we've identified locations in our facility where we can take care of infected patients and avoid exposure to the general population. One thing, though, the pandemic hasn't changed, though, for us is how we care for our patients and meet the need of our community, not just those patients with COVID-19. Our focus is to keep all of our patients, our staff, and our providers safe, and ensure that those seeking care at our facilities for other medical needs can be managed in a safe way. We are currently requiring both patients and staff to wear masks while in our facilities, and we're actively screening patients and staff for symptoms of COVID-19 on a daily basis. We also require that patients coming in for certain procedures are tested for COVID-19 prior to the procedure to provide appropriate care and reduce the risk of infection for our caregivers. Other precautions that we've undertaken include cleaning our facility and requiring that persons socially distance while they're inside. Still, we never lose sight of our mission, however, with all of these things, all these changes, all the precautions that we're taking, we never lose sight of our mission, and that is to make the healing presence of God known in our world by improving the health of the people we serve. Our motto here at The Vintage is "Hello, Human Kindness." And one of the things that we do is that as we orient new employees, as we interact with our board and our physicians, we want to make sure that everyone is committed and aligned with our motto, "Hello, Human Kindness," which encompasses compassion, integrity, inclusion, and excellence. Every day, if you've been at The Vintage at 8 a.m. and 8 p.m., we actually take a moment to reflect on prayer and recite our mission statement. It helps set the tone for the patient's experience. It helps set the tone for our clinicians who are providing care. It centers us back to our core, and it allows us to have a reflective moment each day as to why we chose healthcare. I get an opportunity to round on patients every day, and one of the things that they say is the highlight of their experience here at The Vintage is that 8 a.m. and 8 p.m. reflection wherein our chaplain provides a message to our staff to encourage them to do the what we say is God's work every shift, every day.
Mario, that's awesome. Thank you so much for joining us today. Congratulations on 10 years. We were part of that groundbreaking 10 years ago. I can't believe it's been 10 years already.
Time
But
flies.
time flies. And we're so thankful that CHI St. Luke's is bringing wonderful, friendly, faith-based, quality healthcare to our northwest quadrant of Houston, and especially Cy-Fair. We have such a big community that we have to have it. We have to have it. And we so appreciate you being involved. I know you were a speaker at one of our other committee meetings, and it's a pleasure getting to know you and continuing to get to know you and the hospital more. I didn't realize how many departments that you had. You do have dynamic specialties and can service anyone, anytime. So thank you for being with us today, and we look forward to working with you even more.
Well, I would like to share, it is absolutely safe for patients to come to the hospitals, particularly if they're emergency or life-threatening conditions like a heart attack or a stroke. Quick treatment can be the difference between life and death. And so people should not avoid emergency care, and don't avoid the hospitals when you need us. We are here. We have all of the precautions in place. We're very proud of our outcomes. And I want to encourage everyone, with Hello Human Kindness, I think one of the kindest things you can do right now is to continue to prevent the spread of the coronavirus. That is wearing masks in public, avoid large gatherings if you can, and wash your hands.
Very good. Thank you so much for saying all of that. Hello, kindness. I love that. The hospital is beautiful, state of the art also, and I would not even hesitate to come into the hospital to get treatment or a surgery, it's the safest place you can be, I would think, right? Yeah. And we know you'll take care of us for sure. So, well, thank you for joining us today. It's good to see you.
Thank you. And ladies, don't forget Breast Health Awareness Month. Go get your mammogram. We have a mammogram. We have mammography services here at the benches. We're here if you need us. Thank you.